Now, the Basic Health Care Provision Fund is a federal government initiative aimed at strengthening primary health systems across Nigeria, and it is showing promising results in Adamawa State. Primary health care facilities in the state are effectively utilizing their monthly allocations, which is improving access to essential health service for rural communities. Trust TV's Gibson Sardigo reports.
The Basic Health Care Provision Fund is addressing critical gaps in primary health care delivery across Adamawa State by providing 100,000 naira monthly to each primary health care facility in the state. Over the past 3 years, this funding has been used to renovate wards, purchase essential drugs, and provide free maternal and child health care. Several primary health care centers that previously struggled with limited resources and staff shortages are now bustling with activity. Each month, these facilities receive direct funding from the Basic Health Care Provision Fund, and the impact is evident.
The time that we don't have this fund actually is very difficult, because there will be a time that you will see most of the drugs will not be available. We really want it to continue because it has impacted so many lives.
The Adamawa State Primary Health Care Development Agency reports that primary health care centers now receive monthly disbursements directly from the central bank, promoting transparency and accountability. Community health committees also play a role in monitoring fund expenditures, ensuring every naira is directed towards improving patient care.
Indeed, it's a very commendable scheme where it pre-position funds so that those activities that ordinarily are not well funded, whether by state, LGA, or whoever owns the facility as federal, is not well funded, and it will be able to address these service delivery gaps that are very critical for quality delivery of primary health care services.
Patient attendance at primary health care centers has more than doubled in the last 3 years. This significant increase indicates that the Basic Health Care Provision Fund is achieving its intended goals.
Before the funds get to a state, the funds must be a central bank TSA account, so the money enters a central bank account. And from the central bank account, we call it direct facility financing. The sum of 100,000 naira goes to each primary health care facility, one per political ward. So in a quarter, each health facility will receive 300,000 naira. And the money is disbursed quarterly from national, then the MPHCDA gateway to the MPHCDA, then from the MPHCDA to the State Primary Health Care Development Agency, from the State Primary Health Care Development Agency to the respective primary health care facility.
Many patients we spoke to off-camera remarked on the effectiveness of the project and expressed a desire for an increase in the monthly allocations of the Basic Health Care Provision Fund. Recently, the Health Ministry approved the release of 32.9 billion naira to primary health care centers across the country. This marks the third tranche of the year following 2 earlier disbursements. However, the funds are yet to be disbursed. Gibson Sardigo, Trust TV News, Yola.